Well, Dr. Jay Bhattacharya, thanks so much for joining us and taking the time here today. So I want to start out because you were in Stanford, California, one of the most beautiful places in the country for decades. So what made you want to leave the comfort, the beauty, everything that you knew and loved to join this administration?
It is an absolute honor to actually use the things I've been working at for decades. I was at Stanford for almost 39 years, which is hard to say, and it was really hard to leave. But what President Trump offered me this chance to lead the NIH, who could say no? Like we can use this institution to actually make America healthy. Well, that's what I've been working toward my entire career. It's a very different environment in DC than Stanford, I'll grant you that.
Well, there's been so much to do in so little time, right? That's what they say. What do you want to get accomplished in your time here? How would you describe your approach to taking on this job?
So what I want to accomplish is I want to fulfill the mandate that President Trump and Secretary Kennedy gave to me, which is to use the NIH to do the research so that we can understand how to make America healthy. Right. So, for example, we just launched this major initiative where we're going to get the scientists across the country to actually answer the question, why is autism rising? I'm a scientist. I don't know the answer to that question. And frankly, it's a taboo question. I would like to have the NIH essentially get the scientists of the country to focus on it. And when they focus on it, they will get an answer, because we're really good at that if we can do that.
Yeah, let's dive into autism a little bit more, because if you look at it, the last 30 or 40 years, it has now become an epidemic. Right? But how do we go through and as a government just say, okay, we see the rates rising and allow this to go unchecked for now we're going on decades?
Well, somehow the problem with autism is that first the rise, when you look back, is just meteoric, right? So one in 1,000 just maybe a decade ago or 2 decades ago, 1 in 10,000. I mean, and now 1 in 31 is the latest number. But it's one of those things where it's a slow boil, right? Where you don't notice it. A lot of families just deal with it, and then on top of it, there's this overlay of if you notice it, that you're somehow anti-science, that somehow you're automatically anti-vaccine. If you just notice the fact that there are so many more autistic kids than there were when I was a kid, you put that together, and what you have is millions of families that don't have an answer to this question. But why is my child acting in this way? And there's a wide range. There's kids who are high functioning. I have lots of friends like that. They function a little bit different than other people, but they're really just they're great people. All of them are great people actually. But and then there's instances of autism where it's very severe. Mm-hmm. Where people have repetitive motions and they're nonverbal, and the problem is if scientists can't ask why the rates are rising, then we can't get answers to these families. How best can I care for my kids? Right? That's really the question.
You mentioned you and Secretary Kennedy are working on this together now. Obviously, if this was simple to solve, we would have already done it. So there's not going to be a one-stop shop approach to this. So what benchmarks do the two of you plan on using to measure your progress throughout this?
Well, so first, we're cutting red tape so that we can actually get an answer, right? So the NIH is really good at providing these answers, but very often there's so much red tape to make it so that we get the support to the scientists that have the insights to answer the question. We're going to gather data from across the country in a way that protects confidentiality of the patients and the patients' rights. Not we're going to go find autistic kids and put them on newspapers. No, what we're going to do is we're going to make sure that the scientists have access to the data so they can actually answer the question. The benchmarks will be, in just a few months, we'll have a dozen or more research teams with where we chose them competitively from lots of research teams across the country. We'll put their proposals in. We'll choose them competitively to say, okay, who are giving the most promising questions? It'll be a range of methods, so basic science, lab work, to epidemiology, to you name it, and with no holds barred as to the hypothesis. Right? Whatever the scientists think might be promising as a cause, they'll be allowed to look at and then we'll have answers from them. We'll get them to say, here's what our bottom line is over the course of the year or so.
I think that a lot of Americans are still just outraged that we don't have any answers for this. Another thing that is true for is COVID-19. And if memory serves correctly, your face was on posters all over Stanford's campus back in the day. So what was it like to be in your position, knowing the things that you knew, and actually being one of the lone voices that was willing to speak out against this when the rest of the industry was saying, no, you're wrong, and don't say the things that you're saying?
It was a shocking experience for me. I thought that scientists had free speech. I thought scientists had academic freedom, and I've learned differently in fact, probably the biggest problem during COVID was that. Like normally, if you can't have free speech, then you can't have science, is what I learned. And I think that's why we had such bad outcomes with COVID. We suppress speech of scientists, we suppress speech of the Biden administration suppressed speech of normal Americans who questioned the school closures, the lockdowns, and all the policies that didn't actually protect anybody, that yet ended up harming so many people at scale. So that's actually another one of my priorities. I want to restore free speech in science. I'm going to put in place policies within the NIH itself so the scientists at the NIH can say what they think. Maybe they'll disagree with me. That's fine. And restore the sense that Americans have that scientists respect their rights. We're not trying. A lot of times, actually, what happened during the Biden administration, you had the scientific institutions of this country funding scientists in order to suppress the free speech rights of Americans. It was absolutely shocking. President Trump, I think one of the first actions he did was to say no more of that, no more suppression of speech, no more censorship. And a big part of that is to make sure that scientific institutions of this country never again play a role of papering over, giving scientific cover to the censoring of speech.
Yeah, so you, along those lines, you had been critical of past NIH in the other previous administration. So when you look at this, you actually, I believe, called it a culture of cover-up, especially around COVID-19. So what are some of those things that you want to do, that you want to just signal to others that could potentially be in your shoes in the future?
Well, I mean, I think the cover-up, actually, probably the most important element of the cover-up was what caused the pandemic in the first place. Americans deserve an answer to that question. I've seen a lot of evidence from the outside which convinced me that it's very likely that this virus was the result of humans conducting experiments in China primarily, but unfortunately also with some NIH money and support. Americans deserve to know, the world deserves to know what happened, and even more importantly, the Americans deserve to know that our taxpayer money will never again go to doing experiments that have the potential to cause a pandemic. I think there's lots and lots of action within the administration on this, and I've seen just very hopeful signs that, and we want to put it. Most scientific research is not like this. We're not going to pose a danger of causing like mass scale destruction, right? We're not generally, exploding nuclear bombs or something. But some scientific experiments do have that capacity to do it. Not just the gain of function work that we were talking about. I want to make sure that the American public can say no to that kind of experimentation, that we use the money responsibly to make America healthy, not put Americans at risk.
I have to ask you, just on a personal note, when you see places like the New York Times coming out and they're like, oh, by the way, it was a lab leak. And people were so frustrated for years that it was only like a few voices out there saying, okay, these are the things that could possibly be there. And the silencing of information. And now to see publications like the New York Times and others come out and just say, oh, we've been here all along. We knew what you guys were saying the entire time, and count us in that group.
That's how you know you've won. Yeah. I mean, I think it's unfortunate. Again, the censorship was the key thing, right? The censoring of voices, the censoring of scientific data, that on the lab leak, on vaccine injury, on the inefficacy of lockdowns, the harms for school kids, all of that. The censorship was the reason why we had the policy failure, and we're gonna reverse that in this administration. We've already worked to reverse that in this administration. President Trump has done a fantastic job on this.
Well, we look at the COVID shots then. That's the thing that is still ongoing at this point in time. We see all the VAERS numbers that are out there. We see there are still so many unreported side effects that are out there, and they're still, in many people's minds, dangerous. So they're still on the market right now? Is that what they should be? Are you going to take steps to address that?
So that's the FDA's job, right?
Yeah.
So the kind of job that I'm in charge of, that the National Institute of Health is, we can and we will put in programs so that we can ask questions about vaccine injury. Again, these are questions that are like normally taboo. You have the FDA sometimes sort of slowly look at it after the fact. Too slow, actually. The NIH should be involved in making sure that those questions can get asked. The scientists can get support for asking them and answering them. So I think it's going to find a range of, I think with the COVID vaccine in young men, there's really good evidence that we cause myocarditis, the heart inflammation in a lot of young men for no reason, really. The use of the COVID vaccine is really, at this point, almost, it's very, very low fraction of the population using it. And I think the FDA's policy I don't know. I shouldn't speculate where it's headed. But what I'd like to see is more rigorous evaluation before you approve vaccines. Because when you're asking millions of healthy people to take it, you want to make sure that you have excellent evidence that you're not harming subgroups of those people, and that you actually are preventing the disease you say you want to prevent.
So will NIH try to go through and fund future studies looking at mRNA and making sure that this is something that we should allow or not allow based on research? I
think the NIH will absolutely fund studies to understand better the safety profiles of new technologies, mRNA among them. So I think, again, the answers are going to be whatever science finds. I'm not going to put a thumb on the scale of it. I just want to make sure I'm clear. A lot of the childhood vaccines are really worthwhile. I gave my kids those childhood vaccines, measles, for instance, right? So I'm not against vaccines. What I'm in favor of is that we are honest about when these vaccines aren't working, and that we tell the American people that we've taken an honest look. And that's what the NIH can do, is we can say, let's support research to do that. And
I think that's all Americans are looking for, is a fair shake of everything, and not just looking at one bias or another, but just saying, here is all of the research, and here's the conclusions that we found. But we're on our way to making America healthy again. Everybody's out there. It's all the rage right now. And you guys, artificial food dyes are no longer a thing in the United States.
We are no longer going to have kids ingesting petroleum-based dyes. What's funny is, I heard some of the pushback I heard was, well, there's no proof that they're harmful. Well, why would you give your kids petroleum-based dyes? If I were to run a study like that, you'd call it unethical. If I randomly inject petroleum-based dyes into kids. So why are we feeding our kids that at scale? It makes no sense.
And red dye 3, I remember they said that it was banned from cosmetics decades ago, but it's still safe for you in your food. It's okay. Don't worry about that.
What Dr. McCary, the head of the FDA, has said, and he's right. There are alternatives. You can put beet juice in to make, if you want red. You can put watermelon juice. There's other alternatives. The dyes that were approved here in Europe, the same companies sell them with beet juice, with watermelon juice, with actual natural ingredients rather than petroleum-based products.
All right, final question for you. It's just about DC, about the swamp. What's life been like for you in these last few weeks?
It's about been a month. I've been in office, and it feels like it's been 4 years. But it's exhilarating, actually, and it's also I have this sense of great responsibility that I want to use the power that the NIH has, which is to induce excellent science for the benefit of the American people. That's what at the end of my time here, and eventually will end, I hope I can look back and say, yeah, we really did the work that made America healthier.
I think that if you're able to do that, the American people will be very, very happy with that. Thanks so much for your time.
Thank you.